The biggest delivery of doses so far, more COVID-19 vaccines touching down in Canada. But getting those shots into the arms of Ontarians could potentially be more complicated than first thought. Good evening. Instead of a single unified plan, the province says it's up to each health unit to come up with its own delivery model.
That means 34 separate strategies with the same end result. We begin our coverage with CTV's Queen's Park Bureau Chief Colin DeMello. Colin.
And Michelle, critics say this could lead to a patchwork of vaccination plans in this province and confusion over exactly when we're all going to get our vaccines. As hundreds of thousands of doses of the COVID-19 vaccine touch down in Ontario, the question of when you will receive the vaccine and how became less clear today after the Ford government revealed that instead of one province-wide vaccination plan, Ontario will have 34 plans led by the public health units.
So it's up to the local medical officers of health to fashion a plan, whether it's going to be mass vaccination clinics, whether it's going to be through pharmacies, whether it's going to be through physicians' offices.
Once the vaccines arrive in Ontario, the province is responsible for the distribution and prioritization of who should go first. The rest of the work, from planning the rollout to contacting people and administering the shots, are the responsibility of the local public health unit, leading to what the government calls a unique set of plans.
It's very much public health unit by public health unit. So I happen to have two in my community, and I can tell you that in the north half, the family physicians are reaching out to over 80 patients and saying, you're next in line, be ready to get vaccinated.
Critics argue the province should be taking a more hands-on approach.
We just need the government to deliver a clear plan. People want to know, kind of approximately when am I going to get a shot in the arm, and how the process is going to work for me to set up my appointment to get the shot in the arm.
But medical officers of health argue differently. They say local health units are the best equipped.
It has been our mandate to provide immunization and to organize for large-scale immunization responses to communicable disease outbreaks, including the H1N1 influenza pandemic 11 years ago. So it would actually be entirely in keeping that we would play this role.
Now those public health units are looking for vaccination sites, tapping health professionals, and hiring staff to prepare for a large-scale rollout. The medical officers of health say what is going to make this challenging is the ongoing pandemic response. Remember, those public health units have to take care of case and contact management. They have to respond to outbreaks. They have to enforce all the provincial restrictions. And as well, now they have the vaccines. They say there is a lot on their plate, but they seem up to the challenge. At Queen's Park, I'm Colin DeMello. Now back to you.
Thank you, Colin. The Ministry of Health says just under 13,000 doses were administered in Ontario yesterday. That brings the province's total to nearly 570,000 since the start of the rollout campaign. And more than 240,000 people are now considered vaccinated, having received both required doses.